So people would be aware that there is a new awareness campaign that has been launched, and we're going to hear a little bit more about that today. I'd like to invite Patrice Wallace. Patrice is the manager of the health practice at WorkSafe Victoria, to come up, along with Janelle Hearn, who's the manager of worker health and wellbeing at the Department of Health and Human Services. And Patrice and Janelle are going to tell us a little bit more about the occupational violence and aggression awareness campaign, It's Never Okay. So thank you, Patrice and Janelle.
Thanks, Heather, and thanks, Claire, for the opening. I would also like to acknowledge the traditional owners of the land on which we meet today, and the Wurundjeri people, and pay my respects to elders past and present and any who might be with us today. Janelle and I are going to start the day by showcasing the Occupational Violence and Aggression campaign that launched last week. Many of you will have already received some communication around the campaign and may have already seen the ads on TV. We thought it'd be a great opportunity today to take you through how the campaign came about and the process we went through to get it to the final product that it is today, of which we're really proud, and we're hoping that's going to have a really significant impact. This is the first time that the Department and Ambulance Victoria and WorkSafe have worked together on a campaign like this, and it's been a really successful collaboration. How do I do this? Right. So we know, by way of background, we know that OVA in healthcare is a major occupational health and safety risk. The research suggests that up to 95% of healthcare workers have experienced it, but only 1 in 5 or 20% report it. OVA claims in healthcare are on the rise. In 2005, 18% of all OVA claims were from healthcare workers, and in 2014 that increased to 25%. We also know that healthcare workers are 4.7 times more likely to submit an OVA claim than other workers. And of course there was the recommendation from the 2015 Victoria Auditor General's report into occupational violence in healthcare that said that WorkSafe, the Department of Health and Ambulance should work together to develop appropriate public messaging to increase awareness of the issue and also the need for appropriate and respectful behaviour towards healthcare workers. So thus the campaign begins. So throughout the development of the process, we've undertaken significant stakeholder consultation. We used two key groups of stakeholders for this consultation: the Department of Health Violence in Healthcare Reference Group and the WorkSafe Health Practice Stakeholder Working Group. There's a broad range of expertise involved in these, across these stakeholders, including health services, executives, managers and workers, unions and other employee representatives. They've been involved from the very beginning, from providing initial insights into the problem, along with helping to develop the campaign objectives, the creative concept and the TV ads, and also reviewing and development of all the other campaign and communication materials. So we're confident we've got a really great product thanks to the insights and input from all the stakeholders that we've involved along the way. As with any WorkSafe campaign, extensive research was undertaken prior to the event, prior to even beginning development of the campaign. It takes a long time to develop one of these campaigns, more than a year it's been going on. So the way this starts, one more. Sorry. So the way it starts is we at WorkSafe engaged our research partner, ISCAR, the Institute of Safety, Compensation and Recovery Research, to conduct a literature review and data analysis to really understand what was going on. And some of that data I just talked about before has come out of that. And then, as I've already said, we involved the stakeholders with initial meetings, and there was some market research, in-depth interviews that occurred with healthcare workers in the community. All of this gets put together and we come up with a campaign model and the objectives, which I'll take you through in a minute. So the campaign research identified that there's a spectrum of violence and aggression that occurs from the lower levels of aggression, like eye-rolling, sneering, through yelling, intimidation, up to the physical end of the spectrum, including biting, scratching, pushing, punching and strangulation. And I'm sure all of you have heard about incidents across the spectrum in your health services. Whilst it's obvious that the effects of the more extreme acts have on people, it is important to note that the cumulative effects of the behaviours at the lower end of the spectrum can have a significant impact on people's health and wellbeing as well. So for the campaign, we want the general public, as well as the healthcare workers and employers, to believe that none of this behaviour is acceptable, not just the behaviour at the extreme ends of the spectrum. The other thing that came out of the research was the acceptance continuum. So we know that at one end, people with dementia, mental health issues, and even those affected by drug and alcohol, that occupational violence and aggression is more accepted from people like that. But at the other end, where it's much less likely to be accepted from people who are just being aggressive to get what they want. So it was identified that the greatest opportunity to shift attitudes and change behaviour in the campaign was in the person under stress scenario. And this is what you'll see, if any of you have seen the ads, and we'll show them to you in a minute, is where the TV ads have been focused on. Preventing OVA across the board is, however, critical, and that is covered in all the other more detailed messaging and tools that are provided as part of the campaign. Just a quick idea to tell you from the focus groups some of the things that were being said by each of the groups. From the community, the community was really saying people who commit OVA are not like me, this stuff doesn't happen that often, and getting yelled at isn't that bad, so just ignore it. From workers, they were saying, well, it's kind of part of the job, we accept it as part of the job. We need to look after the patient first. Patient safety is patient care and patient safety is the most important thing. And reporting it's too hard, and even if we do report it, sometimes things don't get followed up on. And for employers, it was all about following up on the reports, valuing staff, and also putting into practice the organisational positions like zero tolerance. So not just articulating it, but really walking the talk. So all of this research then fed into the campaign model. So the objectives campaign are all about increasing awareness, and that's about the fact that OVA against healthcare workers happens, and this is really aimed at the general community, so the public, who don't recognise the extent of what the issue is or the problem is at the moment. Then it's about changing attitudes so that it's not seen as part of the job, and this is for everyone, from the general community, healthcare workers and employers. We need to see a shift in the sector and also in the general community about that. And finally, it's about generating action. The end goal is really behaviour change. And in a nutshell, the aim is we want the community to stop the behaviour, we want workers to report it, and we want employers to prevent it. So, we need to take them through. So we're going to show you the ads now.
I work in aged care to give elderly people the care, emotional support and companionship they need. I care for your loved ones, your mothers, fathers, husbands, wives and grandparents. And this is how you treat me?
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
So here's the nurse one.
I'm here to help when you need it most. Coordinating your care, listening to and supporting you and your loved ones through your recovery. And this is how you treat me?
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
And the last one is the paramedic.
As a paramedic, I help in life-threatening situations. Seizures, drownings, babies on the way, or who've stopped breathing. It's my passion. In an emergency, I'm here for you. And this is how you treat me.
Up to 95% of our healthcare workers have experienced verbal or physical assault. No matter what the situation, it's never okay.
So, pretty powerful message there, and as you can see, it represents the spectrum of behaviour we're talking about. So, So we're pretty proud of it, as I said. The campaign's going to run until the end of July, and then we'll run some more. It will be evaluated, and then we'll run some more bursts in the next financial year. What on this slide here just shows some of the still images that are going to be part of billboards and on posters, so the outdoor advertising and posters, and we've also got some radio. Janelle's going to take you through a little bit more around some of the more detailed campaign materials from now.
Okay, so all the ads and campaign materials were tested with focus groups. So the focus groups included workers, so paramedics, nurses, aged care workers, and we had 2 groups of the public. So they were given a question and divided up into groups that were perhaps more likely to commit OVA and less likely, so that we could get the range of perspectives. So there were that involved independent scoring and then further discussions and feedback about the campaign materials. And particularly, I guess, what was noted in that feedback was, I guess, that they all scored, the average scores were 9 out of 10 for all of the objectives. So those were around increasing awareness, increasing the belief that it's not part of the job, and also the belief that extremes, acts of violence, as well as those yelling and threatening and more aggressive forms are all unacceptable. Some of the key comments that were made, and I guess that's something that we hadn't specifically put in, but certainly wanted as part of the campaign, was them to pull away the message of respect, and that was really discussed in these focus groups, that they acknowledged that they needed to have respect for healthcare workers, and also they were thinking about if they were there with family members, that they would keep that. They felt that they would keep that in mind, and it would make a difference if they were to step in and help moderate their family members' behaviour. So the different media channels, so no doubt you may have seen it already on TV. It'll be in Metro and Regional and all the different channels. Regional cinema, it'll be on radio, it'll be on bus panels and train stops, on the sides of buses, and also online. And there's a part of that as well where if people are using social media within a hospital, then it's more likely to come up as well. So really making that connection. So resources that are available to support this is, you will have received emails last week when it was launched, and the hard copy packs are currently being sent, and you've got some materials today in your show bags. But that will include a guide on what to do next, some brochures on the key messages around the campaign, a case study booklet which shows a few of the different things that are happening across different health services and aged care, and posters for staff as well as posters for community, and I'll go through those in a second, as well as organisational response framework, which is the new framework that's been released last week with the department, and also a presentation template, so it helps you to do some awareness raising. You can just add in your specifics for your health service and raise that with your staff. So the staff posters, you've got some of those in your bags today, and there's a spot down the bottom as well so that you can put how to actually report in your individual health service. The wording down the bottom is quite small, so that reads up to 95% of our healthcare workers have experienced verbal or physical assault, but these incidents are currently chronically underreported. Aggression and violence is never okay. Report it to your employer so together we can work towards reducing these incidents and stop it happening to you and your colleagues again. And then there's a box for your individual process. The brochure and case studies, they're just some examples of what has happened around a number of health services, and some contact details also to get in touch with those health services. And WorkSafe have updated their guidance, so their key guidance has been refreshed, and there's a link on the campaign website to get you to that. It's not in your packs today, it's quite a bulky, chunky, lots of good juicy material in there, so you can click on that in the link. And the communications toolkit you'll find on the website campaign, the campaign website. And you can click on those. It's got your email signature, it's got your newsletter articles ready to go, it's got your PowerPoint templates and all your creative elements, so your images that you can use, and you can use those specifically for your health service. So have your comms teams look at those. And campaign website, you can actually, there's a little spot there that you can actually download further copies, so you will get a pack which has the copies, but if you'd like to order some more, there is a spot to order those as well. So that's more posters and brochures. So next steps. So I guess the key things we'd like you to take out of the campaign and to really make the most of it within your local health service is, I guess, as boards, to understand your local risks and trends, ensure that reporting occurs and that you know about it at board level. The mechanisms for consulting with your workforce are in place, and that when you've identified those risks, that a risk management approach is used to act on those issues with intending to aim to prevent those. As CEOs, it's a great opportunity to encourage incident reporting, creating a culture that values investigation, learns and feeds back to staff, so that it's further reinforcing reporting and the benefits of reporting, to actually understand your risks even further and come up with have the opportunity to come up with greater ideas and strategies to prevent. Conducting awareness raising events, so you've got the template for the PowerPoint, you can use those and use all the materials and talking to your teams. The framework, which Denise will talk about shortly, so have a look at that. That's a really good opportunity to look at what gaps there might be. And really make a commitment to taking action to prevent it, manage it and also respond to it. Any questions for us?
Thanks, Janelle. Patrice, does anybody have any questions of Janelle and Patrice? How many of you have seen the campaign? Yes, we have a question over there. Put your hand up first if you've seen any of the ads to date. Good, okay. Thanks. Over to you for your question. There's a microphone behind you, and if you would like to just introduce yourself, that would be appreciated.
Mary Wheeler from Bass Coast Health. I'm just interested in the role of the whistleblower process in healthcare services, and how, if you found this is being used by staff, or if it's chronically underreported, it suggests that it's not being very actively used as a resource for staff.
So that didn't come up specifically in some of the research, but the findings around the research was that the staff felt like if they didn't hear back about reports, and they weren't able to visibly see what happens when people do report, that they were less inclined to report, and didn't feel like there was any purpose to it, and acknowledging also the system and the difficulties of, I guess, the incident reporting system and the length of time to do that. They really felt that because they didn't see anything come of it, that was a factor, one of the factors, as well as the system, in not reporting. And so that's really about, I think that's where we were looking at, really around that culture of supporting and feeding back and involving the staff to actually show that there is action being taken from the reports to reinforce that. Yeah.
Thanks, Janelle. Thanks for the question. Any other questions? I have just one question about evaluation. Is there a plan to evaluate the outcomes of the campaign? Patrice?
Yes, with all WorkSafe campaigns, we do a full evaluation of the effectiveness of it, and we will include in this evaluation evaluating the collaboration as well. And so I think the outcomes of that evaluation won't be available till sort of November, because we've got to see how it runs, evaluate how it worked. There's all the social media evaluation that happens around it as well. So I think November we'll get the evaluation, and then we will, after that, determine what we then do with it. Yeah.
Thank you. And George, there's a microphone there for you. Thank you.
George Brakeberg from Bowen Health. With the focus groups, did you include medical staff, allied health, clerical staff as well? And did you find any differences between the craft groups in terms of their responses?
So there was a range represented in the focus groups, but then also our stakeholder groups that we went to, and using the Violence in Healthcare reference group also gave us the different connections. So it was used in probably a number of different ways. And the responses were really pretty consistent around it. Probably the experiences were a little bit different around, you know, the eye rolling and the yelling and the experience of that versus the physical. But essentially the messages were fairly similar. Yeah.
And I'll just make one other comment about that, about recognising that it's not just the clinical staff that are exposed to this, and they're not just part of the solution either. So everyone that is exposed to patients or patients' family can actually either help with the solution or aggravate the problem or be exposed to it. So we are actually including that in all the work.
Thank you. And I think we have perhaps one last question over here. Thank you.
Yep, my question is just about staff training. You've put out the guidelines around that. Will there also be some guidance around who are providers that are providing training to meet those guidelines?
Do you know?
I might leave that for Denise, because she's going to talk about the broader Department of Health work. I'll just do a nice handball there. Next. So, yeah, there will be some info on further training and also some further resources around that. Yeah.
Fantastic. Okay, I think we might just bring that session to a close, but we'll be hearing shortly from the department about the broader strategy. So can you please thank Patrice and Janelle for that presentation?